Hello, this is Group 5's presentation on medication versus lifestyle on managing eczema and severe allergies in young Hispanic females. This is for the Nursing 3214 Evidence-Based Research class at the University of Texas at El Paso College of Nursing. Group 5 includes Vianney Maguer, Victoria Cardona, Paulina Cuellar, and Abigail Garcia. For our presentation, our table of contents includes the introduction, the case study, the PICO statement, our search methods, the synthesis of evidence, the nursing implications, our conclusion, and references. So for our introduction, eczema is a chronic inflammatory skin illness which affects millions of people worldwide and can significantly disrupt everyday life and well-being. The symptoms of eczema include chronic itching, dryness, and inflammation that lead to emotional stress and social isolation, in addition to physical suffering, according to the National Eczema Association of 2024. Environmental stressors, such as climactic shifts and exposure to unknown allergens, frequently worsen the illness, especially in people who move or undergo lifestyle changes. The lifestyle changes also include any stressors, as in mental stressors. It usually takes a mix of stress reduction, allergy avoidance, and regular skincare practices to control eczema. In continuation with our introduction, however, by focusing on the underlying immune response that causes the inflammation, prescription drugs and immunotherapy may provide extra advantages for people whose symptoms are still unmanageable with lifestyle changes. Determining the best strategy for enhancing symptom control and quality of life in young people, specifically Hispanic young females with eczema and severe allergies, requires knowing if medications therapy produces better results than lifestyle modifications alone. This raises important clinical questions. How does relocation or environmental change impact eczema severity? Can prescribed medications offer greater symptom control than lifestyle adjustments alone? For our case study, BT is a 20-year-old white Hispanic female, recently relocated from El Paso to Austin, Texas. Since her move, she has noticed a significant worsening of her eczema symptoms, which are accompanied by joint pain and persistent discomfort. BC also reports allergies to pine nuts and nickel, both of which have impacted her daily routine and overall quality of life. She recalls an emergency room visit in 2023 for an anaphylactic reaction caused by pine nut exposure. BT rated her current discomfort as a 6 out of 10 on the pain scale, noting that her eczema symptoms used to fluctuate but have recently become more constant. In the past, she managed her eczema using topical ointments, but she no longer applies them and now relies solely on Benadryl as needed for allergy relief. In continuation with our case study, since relocating from El Paso, Texas to Austin, Texas, BT has become increasingly more interested in exploring prescribed medications to better manage her skin condition and improve her quality of life. Given BT's ongoing discomfort, history of severe allergies, and lifestyle factors that may contribute to her skin condition, a comprehensive care plan is recommended. The question then arises: in young Hispanic females with eczema and severe allergies, how does the use of prescribed medications compared to lifestyle adjustments alone affect symptom management and quality of life within 3 months of treatment?
So when talking about our PICO statement, we have a total of 5 different components that we use to create it. We have population, which is going to be our young Hispanic females with eczema and severe allergies. Then we have our interventions, which are going to be prescribed medications. Then we'll have comparison, which will be our lifestyle modifications alone. And our outcome is to improve symptoms management and enhance quality of life. And we want a time frame of within 3 months of treatment. So now to discuss our PICO question that we created was that it was going to be, in young Hispanic females with eczema and severe allergies, how does the use of prescribed medications compared to lifestyle modifications alone affect symptom management and quality of life within 3 months of treatment? So, within our search method, we did a process of searching nursing and medical databases, including PubMed and Medline, for peer reviewed studies related to eczema management and allergen immunotherapy. We limited our search to studies published within the last 5 years to ensure current evidence based findings. We also developed our questions to guide the literature search and identify relevant interventions and outcomes. Reviewed qualitative, and systematic review studies addressing medication use and immunotherapy and lifestyle modifications in eczema management. We evaluated selected studies for the strength of evidence and the applications to our case study, as we are doing a young Hispanic female with chronic eczema and severe allergies. So within our operations and limitations, we had 5 different components as well. So within our population, we did young adults, Hispanic females, eczema, dermatitis, and severe allergies. Within our interventions, we did prescribed medications such as topical corticosteroids, immunotherapy, and pharmacological management. For our comparisons, we did lifestyle modification, stress reduction, skincare routine, and with our outcomes, we did symptom control, quality of life, and eczema severity and treatment adherence. For any phrases that we had, we did and or not. We made sure that it was a peer reviewed, and we had at least 5 years within the currency that we wanted.
This quantitative study is called Treatment Preference Research in Atopic Dermatitis, a systematic review of quantitative studies. The main goal of this study was to understand what patients, caregivers, and healthcare professionals prefer when it comes to treatments for atopic dermatitis, especially looking at how effective the treatment was, what risks are involved, and how it's given. The researchers reviewed 15 studies from different countries, mostly from the United States and several European nations. They collected data by doing a systematic search in major databases like Medline and Embase, and they carefully screened and assessed the quality of each study. The main findings that we found was that the patients cared most about how well the treatment worked and the level of risks involved. Many were even willing to accept higher risk if it meant better itch relief and clearer skin. On the other hand, how the treatment was administered, like whether it was a cream, pill, or injection, was not as important to them. This next study is the qualitative study, which is called Taking Charge of Eczema Self-Management, a qualitative interview study with young people with eczema. The purpose of the study was to explore how young people manage their eczema day to day, looking at both their use of medication and the lifestyle habits that help control their symptoms. This study included 28 participants between 13 and 25 years old, all from medical centers in the United Kingdom. Researchers visited participants' homes to conduct audio and video recorded interviews, allowing them to talk openly about their personal experiences with eczema and their interactions with healthcare providers. The main findings showed that many people struggled to balance medications with lifestyle management. While medications worked well for most, some worried about the side effects or becoming dependent on them. They also found it difficult to maintain routines like avoiding triggers, managing stress, and keeping up with skincare, even though they recognized these habits were key to keeping their eczema under control. Lastly, we have this systematic study, which is called Allergen Immunotherapy for Atopic Dermatitis, Systematic Review and Meta-Analysis of Benefits and Harms, which looked at how allergen immunotherapy, also called AIT, can help people with eczema or atopic dermatitis. The main goal was to evaluate both the benefits and risks of AIT, which comes in 2 forms, which is subcutaneous injections under the skin and sublingual, which is drops or tablets under the tongue. This study included 1957 participants
from 23 randomized controlled trials across 13 countries, included regions in Asia, Europe, North America, and South America. Most participants were children, teens, and adults with moderate to severe eczema caused by house dust mite allergies. Researchers did a comprehensive database search and carefully reviewed each study for accuracy and bias using standard tools. The results showed that both types of AIT significantly improved eczema symptoms and quality of life, but also caused more side effects, especially with the injection form. However, the effects on itching, sleep problems, and flare ups were still uncertain.
So some nursing implications would be assessment, and that's where you're going to evaluate the health history, triggers, skincare, diets, and emotional well-being of the patient. And then you're also going to educate them, and you're going to do that by encouraging hydration and balance nutrition, avoid their allergens or their triggers. So in this case, it would be nickel and pine nuts for a patient. And then you're also going to teach skincare routines and stress management to lower that stress level. And you're also going to do coordination. So you're going to provide referrals to a dermatology and allergies specialist. And then you're also going to encourage the patient to do follow-up appointments to make sure that the medicine is working, the treatment is working, and everything is just going good and she is improving. In conclusion, eczema is a common and challenging condition that affects millions of young adults across the United States, including approximately 16.5 million individuals. Both medication use and lifestyle modifications play an essential role in improving symptom control and enhancing the overall quality of life. While medications provide a faster relief by targeting inflammation and the immune response, lifestyle changes promote long-term stability through stress management, improved nutrition, and constant skincare routines. For young Hispanic females like BT, combining medical treatment such as immune therapy or prescribed topical agents with healthy lifestyle adjustments offer the most effective and sustainable results. A holistic and multidisciplinary approach that integrates nursing education, patient-centered care, and cultural awareness can empower patients to manage eczema more effectively and achieve lasting improvements in both physical comfort and emotional well-being. Thank you so much for taking the time to look at our PowerPoint. This concludes Group 5's PowerPoint presentation on our final paper.